Dr. Fauci, it's Andrew. A behavioral science question of sorts. How concerned are you and how concerned is the administration effectively that engaging in a conversation about boosters makes it even less attractive for those who have yet to take the first shot of the vaccine, that they won't want to take it at all because they're going to say that either it is not effective or they're going to say, I'm not only in for one shot or two, I may be in for three, and maybe I'm going to be even in for more over time?
Okay, so that's really a great question, and it allows me to make a point that we really need to clarify. When you're talking about a booster, namely a third shot in a two-shot regimen, what we're discussing now, or a booster following a single shot of J&J, this has absolutely nothing to do with the effectiveness of the vaccine. These vaccines are highly, highly effective, both in the clinical trial and in the real world effectiveness studies. Let me give you a cogent example. 99.5% of people who die of COVID are unvaccinated. Only 0.5% of those who die are vaccinated. So it isn't a question of whether the vaccine is effective or not. It has to do with the durability of the protection. So there really is nothing wrong if, in fact, and I don't know whether it's going to happen or not, but if there will be a necessity to maintain the high level of effectiveness by having a booster sometime down the pike, that be that a year or two or what have you, be that selectively in elderly or in people who have underlying condition, there's nothing intrinsically wrong with that. We do that with vaccines all the time. When you look at the regimen of the vaccines that you and I got when we were children, namely the measles, mumps, rubella, et cetera, you get a vaccine, you get a second shot, and then a few years later, you get a third shot. So there's nothing new or mysterious about the possibility or even the likelihood that in order to maintain the durability of the protection, that you might need another shot. We've got to make sure we clarify that with people. It has nothing to do whether or not it's effective. We know it's highly effective.
Dr. Fauci, I appreciate that point. The reason I ask the question is because there seems to have been some frustration inside the administration about Pfizer coming out with its announcement anticipating a booster. And from the reporting that I've done, I gather that the concern seems to be that, look, we haven't even gotten enough people vaccinated the first time, and conversations about a booster are not going to help that conversation. And there is a question about should we not engage with that discussion? Do we need to be straighter with the public that maybe a booster is going to be in the offing, and how you think about the push-pull? Because I know that part of this is a behavioral science issue. It became an issue when it came to masking.
Right. You know, you make, again, excellent points. So let me give you my perspective on it. The discussion about boosters is really an appropriate preparation on the part of the companies together with the NIH and the CDC and others in being prepared in the eventuality that you might need a boost. But when you translate that into, we will need a boost, everyone's going to get a boost, that is not appropriate. It's not appropriate for the reasons that you just mentioned, is that we still haven't vaccinated enough people in the primary part of this. We only have 48% of the total population vaccinated. We have about 68 or so percent of adults having received at least one dose. If you think this is an issue in this country, take a look at what the WHO is faced with when they have to worry about the entire world and know that there are some countries when there's less than a couple of percent of the population being vaccinated. And this is a global pandemic, which requires a global response. So you're absolutely right. Here we are talking about the possibility of a third shot boost, and a major component of the world has never even received a single shot. We've got to make sure we take those things into consideration.
Shepard Smith here. Thanks for watching CNBC on YouTube.